this is interesting. New recommendations from the American Academy of Pediatrics this morning that doctors should begin incorporating climate change discussions into clinical practice.
Well, we know a doctor. Dr. Darian is here, joining us here at the desk. And it's a great conversation to have because there are a lot of things we need to parse out. We need to ask these questions because anytime you say climate change today, for whatever reason, it's a political term. And so people immediately get on the defense. Let's start off with, what do they mean when they say climate change and your health? What are these sort of correlations?
You know, I agree it's a political term, but unfortunately it's a reality that we have to just simply acknowledge. When we look at our environment, it directly affects our health, and when we look at public health, it's directly affecting public health. When you look at deforestation, for example, and the proximity of animals to humans, that increases the risk of something called zoonotic infections. One of them being E. coli infections, which sometimes we talk about. Also changing climate, more insects lasting longer, allergies lasting longer in terms of allergic rhinitis and all the complications, air pollution, the soot and the smog that we inhale, that's an ingredient called ozone, which negatively affects our lungs, and then also in general, particulate matter when there's forest fires. So these are all reasons why as physicians we have to remind patients there are very real threats out there, besides our diet, besides being able to exercise whether or not, and you have to pay attention to them.
So how do you incorporate it? Let's give us an example. There's a patient that you are speaking to at the moment. Like, how do you incorporate climate change as you're examining that person?
You know, for example, COPD, chronic obstructive pulmonary disease, is a complication that I see a lot in New York City, a lot around the world in general. And when we're talking to patients, we want to reduce their risk. And so we talk about air pollution. That's a patient that I would advise you should probably be checking your air pollution and thinking about where you live more seriously than others, and mainly because it directly affects your health. Using apps by the EPA to assess the air quality so that you know whether or not you want to grab a mask. Also basic things that you can do in your daily life. Using transportation as a form of physical transportation, getting off the subway stop a little bit earlier. You know, incorporating these small steps can really help change your outcomes, and I think it's really just about paying attention to the changes around you.
And do we anticipate this changing at all? I mean, is this something that's only going to get more pronounced as we go on?
I think Sam can probably detail more of that because unfortunately it's likely going to get worse.
Yeah, I think, again, the important part of this conversation is the topic has been politicized as to whether or not you believe people are responsible for it. But let's not talk about that right now. Let's talk about people's health in the very real world thing that we have. Forest fires burning, warmer temperatures, climate change, meaning those allergy seasons are longer. So let's just talk about the reality of how we face and don't get involved in the conversation. We want our children to be healthy. We want our neighborhoods to be clean. So this is, I think, to me, an important step that doctors are saying. Let's bypass the weirdness of this conversation and talk real terms.
Very matter of fact, and also just with our diets too. I think it's something we have to make cognizant efforts to change. Our diets help us, being plant-based, for example, is healthier in general, but it's also better for the environment.
Better for the environment.
And reducing our carbon footprint. So these are all things we have to think about, and it's unfortunate, but it's our reality.
All right, all my vegan family members. They're on to something. Darn it. Thank you. Always good to have you,
Great conversation.
Dr. Darian.